Pacific Islander Health Partnership has been up and running since 2003. We started at Okapica when Okapica was further up on Garden Grove, just off of the 22. Through Marianne Fu's leadership and being able to bring us together with the Asian American community. We've been doing our work now since then. One of the unique things about the Pacific Islander Health Partnership is that right now we only have, I think, 5 or 6 island groups. So we have Chamorro, so it's Guam, Tonga, Samoa, Marshall Islands, and Hawaii. So now we only have 5 island groups. And so basically how it works is that we ask for 2 representatives from each island group that are selected by their community to come and sit at the table. And so whatever it is that we're discussing there, it is up for them to disseminate that information back to their groups. And if we're looking to work on a project or something, a grant, whatever, then they need to go and get the buy-in from their community and come back to us, and then we can vote and move forward and implement and all that other kind of stuff. Lately, I'm working with the Southern California Pacific Islander COVID-19 response team, response task force, and it's part of a national effort. So we have people, Washington, D.C., Washington State, Oregon, Northern California, Southern California, Arkansas, and Arizona, and Hawaii. So we're trying to figure out how we can help our people get through COVID. When we look at the numbers here in Los Angeles, although our community is very, very small, we are very, very highly impacted. So I forget what the numbers were the other day. So they can talk about percentages, or they can say that out of 100,000, these many people, are affected. But the most impactful numbers for me are when we say that out of my community of roughly 20,000 people in Southern California, 1 in 177 people test positive. I happen to know a family, one single family, multi-generational, where the son-in-law, and the father were all tested positive. And so they had to put everybody else in the house out. They had to go stay with other family members. And the father stayed in his bedroom, the son stayed in his bedroom, and the son-in-law they pitched a tent in the driveway for him to quarantine for 2 weeks. Even for some of the elders, it's being secluded and isolated. They don't have that that person-to-person contact. So we do the phone trees where we're calling them, and we take turns calling, just so that they know that somebody's out there thinking of them. The Western world, they want that alphabet soup behind your name. A lot of what I have between my ears are things that I have learned from aunts, uncles, my grandmother, my mother, that has no certificate. My certificate is when they nod at me and tell me that I did a good job. So even though I live in a Western world, and even though I've acquired the alphabet soup behind my name, the ones that are most important to me are the ones that come from my elders. And so even to talking to people, in, at conferences and stuff like that, they're so lettered and all of that stuff. That still means nothing to me. Even I work with doctors all the time. Doctors just have education in medicine, and they have the expertise of having worked with patients, but, I have expertise in other areas. And so, I think with our young people, it's trying to get them engaged and seeing that they have so much to give